Hey, what's going on, everybody? It's Trading Chief, and this morning I was alerted to by one of our bots in the Bank Mobility Discord to IOVA on a volume ticker bot, and so I wanted to make this video this morning, but I had other things I had to do, so I wrote it down to remind myself to come back and look at it. And what caught my attention was on Friday this news article dropped here. Iovance Biotherapeutics completes biologics license application, and so I just wanted to go over it quickly with you. Um, but before we start, I want to say, you know, don't don't worry about hitting the like button. Don't worry about subscribing. Um, I'm not that type of person, right? If I wanted to do all that stuff, I'll get the views and the subscribes when I get them. If I wanted all that stuff, all I'd do is just go find one of those fucking meme stocks, and just make a video on that trash, and then I'd get everything that I need. But that's not what I'm about. I'm not here to entertain you. I'm just here to pass on the information so that way you can possibly make a better trade. So let's look at it real quick. Stock ticker is IOVA, and I wanted to look at one of these news articles. Which one was it? Actually, I think I already got it pulled up. Right here. So, shares of Iovance Biotherapeutics were up 11% pre-market trading on the 27th after management announced that it had completed the filing of its rolling biologics license application for lifileucel, however you pronounce it. Its lead pipeline candidate. The BLA seeks accelerated approval for lifileucel to treat patients with advanced unresectable or metastatic melanoma, which has progressed on or after prior anti-PD-1 or L1 therapy. The filing is based on data from its cohorts 2 and 4 of the phase 2 C144 TAC01 study, which evaluated lifileucel in patients with post-anti-PD-1 melanoma. Overall, data from these cohorts shows that treatment with lifileucel achieved an objective response rate of 31%, with the median duration of the response still not reached at 36 and a half months. Following the receipt of the BLA, the FDA now has 60 days to accept Iovance BLA for review. So they can deny this. I think that is highly unlikely, and I will show you why in just a second. It might be in another news article, but um, we'll go over why I don't think that's unlikely that it doesn't get approved. The BLA is also eligible for priority review by the agency. If the BLA is approved, lifileucel will be the first FDA-approved individualized one-time cell therapy for melanoma patients. An approval for lifileucel will help cater to the needs of melanoma patients who have already been treated with standard of care medications and have limited treatments options. Lifileucel became eligible for a rolling submission after lifileucel was granted regenerative medicine advanced therapy. Oh, that's right here. This is what I was talking about. Reason why I don't think it will not be approved. Because the RMAT designation by the FDA in advanced melanoma in 2021, a candidate granted RMA designation by the agency is eligible to enjoy all the benefits of fast track and breakthrough therapy designations. So you hear of drugs getting fast track to FDA review. You don't really hear of an RMAT very much. Earlier this January, management also announced that it had reached an agreement with the FDA on the scope of the Phase 3 Iovance 301, which will evaluate the combination of lifileucel and Merck's MRK PDL1 inhibitor Keytruda. So that'll be going um, it'll be evaluated against Keytruda. Against Merck's Keytruda in frontline metastatic melanoma. This late-stage study, which will start later this year, will serve as a confirmatory study from the above BLA. Iovance already evaluated the combination of lifileucel and Merck's Keytruda for the given indication in a cohort of the phase 2 study. Data from the cohort demonstrated an overall response rate of 67%. Opdivo and Yervoy are two of the many blockbuster drugs marketed by Bristol Myers. Both drugs are key top-line drivers for Bristol Myers during 2022. Generated $8.2 billion from Opdivo sales and recorded $2.1 billion as product revenues from Yervoy. So I'm not saying they're going to make $10 billion, but you can look probably somewhere in between or a little bit lower than that. That'd be huge for Iovance. So there's that. I just wanted to share that with you. Let's see. Yeah, I mean, just a quick little video. I just want to bring that one up. I've got a couple more that I'm going to look at tonight. So just, stay tuned and maybe you'll find something that you like. All right. Appreciate you watching. Have a good day.